right.
You can start with that one.
I'll try to do this. They have to do it again. I don't know. Alright, first of all, our sheet. She signed on the back and dated. It's the 7th. We got our little flashcards here. Nothing on them. There's a stain.
Right.
We don't know what it was. Probably chocolate. Chocolate, coffee, whatever. Envelope. Not opened. Probably gonna have to open it again.
She don't want you to redo it.
Probably not, because she put on that tape good. I am doing it. Do I need to there? Alright. You did everything for me, so you looked at all the papers. And now Leonia is going to pick one. Cardiac arrest.
All right. What does it mean when a patient goes into cardiac arrest?
So the circulation of blood flow is absent, and it is circulation of blood flow, and it's not enough to maintain life.
Can an angina pectoris or a myocardial infarction lead to cardiac arrest?
Yes.
What must be done in order to save the life of a patient who has gone into cardiac arrest?
Do CPR as soon as you can.
What is the significance of C, A, B, D as it relates to CPR?
C is check their heart rate, like check the hearts, see if it's beating. CA, check airway. CABD, right? Breathing, check breathing, and then determine treatment.
What position should you place your patient into in order to perform CPR properly?
You're gonna have them supine on the floor, laying flat, so you can start CPR when needed.
If you give your patient 2 breaths and the chest does not rise, what does this indicate?
The airway is closed.
What is the ratio of compressions to breaths when doing adult CPR?
30 compressions with 2 breaths.
When should you stop administering CPR?
When the patient is resuscitated and the patient when the EMS arrives.
What are the 4 things you should send one of your classmates for during an emergency?
Emergency clipboard, emergency kit, AED, and oxygen.
Explain the technique for CPR beginning when you first realize that your patient has gone into cardiac arrest.
All right, the first thing you're gonna do is call Code Blue, get an instructor, call them by their name, get them over there. Second of all, you're gonna check the patient, make sure, ask them, hey, are you okay? You're going to ask someone to go get the emergency clipboard, AED, oxygen, and emergency kit. Then you're going to call 911. Then you're going to go over to the patient, see if they're cautious or uncautious. If they're, in cardiac arrest, you gotta start CPR, so you're gonna start CPR. Then whenever you're doing CPR, you're gonna check their pulse right here at their neck. I cannot pronounce it right, but I know where it's at. So you're gonna check their pulse right there where their neck is. And if it's a steady pulse, you're gonna do 1 breath every 5 seconds. And if it's not there, you're gonna do CPR. And then you're gonna keep doing CPR till the EMS arrives, or you're gonna keep checking their pulse. If their pulse actually comes back, you're gonna switch over to 1 breath every 5 minutes. And You'll do that till the EMS arrives or the patient resuscitates. You'll make sure everything is documented in the medical emergency form and the record of treatment. And that's it. And you keep going on down the list.
How often should we take pulse, blood pressure, and respirations during an emergency?
At least every 5 minutes.
Where should you document everything that occurs during an emergency?
Medical emergency form and your record of treatment.
If your patient has an emergency, where should you remain until the emergency situation is completed?
Remain with the patient at all times until the emergency is resolved.
What is the number one thing you can do to prevent?
Take a good medical history. All right, next. Stroke.
What are the 2 major causes of a stroke?
2 major causes are lack of blood flow to the brain and hemorrhage of ruptured blood vessels.
What are-
Vessels. There you go.
What are 5 common symptoms of a stroke?
Headache, nauseous, dizziness, vomiting, and confused.
What does the S, the T, and the R in stroke represent when trying to identify if a patient has had a stroke or not?
S is smile, T is talk if they're slurring. R is raise the arm to see if it droops down. If it droops down, then you know it's a sign of a stroke.
How does a stroke usually affect the pupils?
Pupils are 2 different sizes.
Would you give aspirin to a patient who is having a stroke? Why?
No, because it can it can cause a cerebral hemorrhage. It's like the brain bursts, like the blood vessels burst in the brain. There you go. I'm explaining it. All right, continue.
What position should you place a patient in who is having a stroke and why?
Upright if the patient is awake, and supine if the patient is unconscious to help with the pressure of their head, and you can do CPR as soon as you need to if they're laying down already.
What 4 things should you send one of your classmates for during an emergency?
Emergency kit, emergency clipboard, AED, and oxygen.
How often should we take pulse, BP, respirations during an emergency?
At least every 5 minutes.
Can we give oxygen to a patient who is having a stroke, and how much?
Yes, 5 to 6 liters per minute.
Where should you document everything that occurs during an emergency?
Medical emergency form and patient record of treatment.
If your patient has an emergency, where should you remain until the emergency situation is completely resolved?
Remain with your patient at all times until the emergency is resolved.
What is the number one thing you can do to prevent an emergency?
Take a good medical history.
In your own words, step by step, tell me how you would treat a stroke emergency in our clinic.
Okay, first off, you're going to call Code Blue, get your instructor, call them by their full name, not the last name. They won't go by that. They'll go by their first and last name so they know it's an emergency. Then you are going to lay the patient on the floor, supine. You're going to check the patient's pulse. You're going to call 911. You're going to get someone to get the AED, emergency kit, emergency clipboard, and oxygen. Once that is all done, you'll start CPR. Once you start CPR, you're going to keep doing CPR until the patient resuscitates, or if the EMS arrives, you'll take vitals at least every 5 minutes. You'll give the patient oxygen 5 to 6 liters per minute. You will record everything in the medical emergency form and the record of treatment, and then you will remain with the patient at all times until the emergency is resolved. Okay. Next. Angina.
What are the 3 layers of the pericardium?
Epichondrium, myocardium, and endochondrium.
What blood vessels supply blood and oxygen to the muscles of the myocardium?
Left and right coronoid arteries.
What is atherosclerosis?
Okay. It is when the arteries are artery walls are covered and restrict blood flow.
How does atherosclerosis cause an angina pectoris attack?
Can I see the question? How does it cause an attack? Lowers the blood flow in the myocardium and leads to oxygen deficiency, if I'm thinking correctly. Alright, we'll go on to the next.
Name 3 things that can stimulate an angina pectoris attack.
Exercise, stress, and sex.
When a patient experiences pain from an angina pectoris attack, where is the pain normally felt?
In the chest, this starts with an S. In the chest, and it can be the arms, the neck, the jaw, and the neck, jaw. That should be it.
How long does most angina pectoris attacks last?
3 to 5 minutes.
What happens to vitals during an angina pectoris attack?
They elevate.
What 4 things should you send one of your classmates for?
Emergency kit, emergency clipboard, AED, and oxygen.
What position should your patient be placed in?
An upright.
What relieves angina pectoris attacks?
A nitroglycerin.
Sorry, what are the 2 things that relieve?
Nitroglycerin and oxygen.
How often should we take vitals during an emergency?
At least every 5 minutes.
What is the drug of choice to relieve an attack of angina pectoris?
Nitroglycerin.
How does the drug nitroglycerin work to relieve the pain of an angina pectoris attack? That's the last question.
It dilates the blood vessels.
How much oxygen should we give to a patient who is having an angina attack?
5 to 6 liters per minute.
Where should you document everything?
The medical emergency report and record of treatment.
Where should you remain until the emergency situation is completely resolved?
Remain with your patient at all times until their emergency is resolved.
And the number 1 thing you can do?
Take a good medical history. One more and last but not least. Meow.
What is atherosclerosis, and how can this disease increase a patient's chances of a myocardial infarction?
I'm gonna need this. All right, so it is all right. This is when is the artery walls are covered and restrict blood flow. The arteries are constricted and there's no oxygen.
Pain from angina pectoris occurs as a result of stress or exercise. When does pain from a myocardial infarction usually occur?
When the patient is resting.
In which emergency is the pain more severe and longer lasting? Angina pectoris or myocardial infarction?
A myocardial infarction.
Is the pain from a myocardial infarction relieved by rest and nitroglycerin?
No.
How much aspirin should be given to a patient who is experiencing a myocardial infarction?
4 to 81 milliliters of baby aspirin.
In what situation is not advisable to give a patient having a myocardial infarction nitroglycerin?
Let me see that.
Number 6.
When their like blood flow is down, lowered. The heart rate's down. I don't know. I totally forgot that one.
What typically happens to the blood pressure of a patient who is having a myocardial infarction?
It lowers.
Should 911 be called if your patient is having a myocardial infarction?
Yes, because of the chest pain.
What 4 things should your classmate get?
Emergency kit, emergency clipboard, AED, and oxygen.
What position should you place the patient in and why?
An upright to a sitting position so they can breathe easier.
What usually happens to respirations when a patient is having a myocardial infarction?
Shortness of breath.
How often should we take vitals during an emergency?
At least every 5 minutes.
How much oxygen should be given?
4 to 6 liters per minute.
What should you do if your patient who is having a myocardial infarction goes into cardiac arrest?
Start CPR.
Where should you document everything?
Medical emergency form. Record of treatment.
If your patient has an emergency, where should you remain?
Remain with your patient at all times.
What is the number 1 thing you can do?
Take a good medical history. We're done. And everything is done.